couple thoughts. First of all, how did you arrive at a 50-minute appointment interval?
Previous coaching 6-7 years ago.
Okay. So, there is another way to do it. Okay? So Wendy talks about the 3 roles of hygiene, right? The preventive role, the periodontal therapist role, and the treatment advocate role, right? In an appointment where there's limited time, which role gets dropped? Treatment advocate,
yeah.
right? That's the one that gets dropped. All right, in a well-performing practice, 70% of restorative comes out of hygiene. Is that really what you want dropped? So, while I know there are practices that use a 50-minute time interval and do it well, but it's not easy.
Yeah. We're in the process of changing that already.
And so, Bert, you prefer 60 minutes, and we prefer 60 minutes. And it's because of the math. So we took a bunch of practices that had 40, 50, 60-minute, and then we looked at the productivity of the hygienist, and we looked at the amount of restorative that was coming out of hygiene, right? And guess which was the winner? 60 minutes, right? It was the most profitable. And the reason why people go from 60 to 50 or to 40 is because they think that's going to be more profitable. But they don't understand that it's the treatment that comes out of hygiene that gets dropped as you, right? So, so that's one of the things that I would think to consider.